nice intro. So Brian and I were going to talk about integrating family systems interventions into CBTP practice. Really wanted to talk to this group because all of you are CBTP trained clinicians, and we're planning and hoping to have an opportunity where there's we don't know what best to call it. It's not a certification, a training track, name, official title to be determined, but something where, CBTP trained individuals have an opportunity to get some skills in the world of family systems work, a little bit more structured, practical application. So, Brian and I will be chatting a little bit about that today, and then are hoping to get some feedback and some thoughts about that. And then we'll have the case presentation, and that we'll see how it can tie into what the training track for individuals would have an opportunity to learn and experience. So today we're going to be talking about, why it's so important to involve family systems in general, and including, CBTP practice, an understanding of this potential training track or curriculum, so you can get a feel for what it might be like, and a sample technique from the CBTP world that can be used for working with family systems. So those generalizable skills that can be carried over. So first, when thinking about defining family, family system. So it's really broadly defined. It could be a blood relative, significant other, neighbor, friend. So that inclusive idea of family systems or natural supports. So anybody that the individual identifies as playing a meaningful, significant role in their life. The rationale, so why we know it matters, why we know it works, and why we know it's important. So family systems truly do want and need that support from providers. Professional guidelines across the board, international guidelines, including Schizophrenia Patient Outcomes Research Team, or the Schizophrenia Port Recommendations, which you all heard us talk about a number of times. But the guidelines recommend that family interventions be offered to every individual living with psychosis and schizophrenia. Ideally, that is in the form of 9 to 24 months, but even in cases where that's not feasible or desirable for family systems, even having 4 sessions with family, however that's defined, providing education and information about how to be appropriately supportive to the individual that's experiencing psychosis. 4 sessions in less than 6 months' time, you'll still see positive gains, maybe not as robust, but you do still see some positive gains. And so that's an opportunity in a space where we know that CBTP trained clinicians, even if you're not doing family therapy, there are opportunities for you to still provide that extra support for those individuals with whom you work. Also, I think important to note is that outcomes are improved. When family systems are involved, and they learn how to be appropriately supportive, and they gain the information needed to understand what is happening with their loved one, how to communicate with their better with their loved one. There are opportunities for that individual that you're seeing in treatment to be more adherent to treatment recommendations, including medication, but not limited to that. That means they're less likely to relapse and return to the hospital, which means reduced costs of care on the system. We also know that, individuals getting back to work, getting back to their social systems, getting back to school, engaging in less, risky behaviors, all of these positive kinds of outcomes, but also for the family system, outcomes are improved. So they're feeling less burdened. They're feeling as though they can get back out to, living their lives. So you see less conflict and tension within that family systems, and their relationships are improving. So across the board, we have an opportunity to make a really important impact. So services for family systems we know are important, but currently, and for many, many years, the resources and services that are available for family systems are pretty minimal, and most family systems are dissatisfied with the services that they're receiving, primarily because they're not really being offered. So about 30% of families are receiving basic information about illness and treatment of what's happening with their loved one. and about 8% attend a support group or an educational group. And that's because, there aren't many, both not understanding the role that they play or the benefits to these opportunities, and also because they may be difficult to find, especially at, many of the places where their individual is receiving treatment. So just in general, thinking about, when I'm talking about family systems and when we're talking about family systems, so we're talking about a network of individuals, so each with their own personalities, each with their own histories, each with their own experiences that have this kind of bi-directional or reciprocal influence on one another, but also influence over one another. So impact and influence. These relationships, are complex. There's a lot of emotional investment in these informations, which is what makes it a bit different from group work. Because, when you're working with family systems, these individuals are interconnected, interdependent, have a long history together. We know that the health and functioning of one impacts the whole and impacts the others as individuals. Oftentimes you'll see subgroups that are within these systems that may be working with one another and sometimes maybe working, it feels like against one another. And these systems are very complex and they're always evolving and always changing. And the experiences and the shared experiences are always, occurring within the system, which is impacting that system. So when we're talking about taking a more of a systems approach to care, this is really a sort of a shift in how many of us were trained. We're trained to be individual providers for the most part. And so how we're thinking about and conceptualizing our work, this is moving from more of a client-centric perspective to a more systemic approach in our work, even if you're still working with just an individual and you never see the other members of that family system. It's still impacting our approach with how we are assessing needs, the types of questions that we're asking, the information that we're gathering. So it really is thinking more actively and skillfully about how that individual is within their family system and really discussing with that individual what it might be like to involve members of the family system, to what degree, what are their hesitations, what are the things that may go well, what are the risks involved. And if that individual is interested in going down that path or even involving others in their treatment and care, being planful, strategic, and skillful in how we engage that system and what that looks like. So I'm going to pass the torch on to Brian to talk a little bit more detail about what this training track, whatever it may be called in the end, will look like.
Thank you, Danelle. And so, as Danelle has said at the beginning, the Best Center's response to the low uptake in family work is really to develop a curriculum for practicing CBTP clinicians to use skills that they already have, but just apply them to working with families. And so the rationale for that is that it does take a targeted set of clinical skills to work with families, but these are not skills that are new to you. You already use these skills in your individual work. We're just trying to take those skills, expand them, and apply them to family systems. Our goal is to help you feel confident in working with families. I know that for many clinicians, especially if you haven't been trained to work with families, it can feel a little bit intimidating to work with multiple people, especially multiple people who might have very different opinions about treatment or conflictual patterns of interacting with each other, some of which can really come into the therapy room. So we want you to feel more confident in working with family systems and develop just sort of like a baseline level of competence in working with them too. Really, we see this as an opportunity to blend or infuse those skills. And so you can go ahead to the next one. So the idea here is to take family systems concepts and apply them to CBTP. Every family system has roles for each person or for each subgroup. There's often invisible rules that kind of emerge in family systems as people interact and form patterns of interacting with each other. And so we want to teach you about those features of families so that you can understand them better and work with them better. We also want to help you first initiate the conversations with people who have psychosis about how to best include individuals and their family members together. Um, each family is different, each family is unique, and each individual's perspective on involving families is going to be highly unique and individual. Some people might really feel closely connected to their family members and want a high level of involvement. Other individuals may want family members to be involved in very specific and defined ways, but also want a degree of autonomy or separation. There's no right or wrong way to do it. It's just a matter of becoming familiar with how that person wants to involve families in their work. And then we want to help you engage family members, and that can be a very difficult thing to do. Number one, because there's just multiple people, right? And so some family members might want to be super involved, some might not want to be involved at all. And sometimes negotiating what family work will look like is just a process that will evolve and change over time. So I want to help you develop skills with that. Also, to help you just address certain topics that can be difficult to address in family sessions, trauma, substance use, the impact of culture, how to include younger children. As we develop this curriculum, we're kind of looking for your input on what topics you would be interested in learning about with families in particular. And so as we think about areas that we want to cover, there's a couple different areas on the next slide that we can talk about. Again, how to engage families, how to assess family interactions and differences within families, their readiness for treatment, what to do when a family member's goal is different from the individual's goal or goals, and just kind of basic skills for exploring what families need and want. There's also a psychoeducational component, right? So psychosis is often poorly understood, not just by, the public in general, but by specific family members, right? Especially if it's their first episode. They might not understand the illness. They might have certain prejudgments about what it means to have psychosis. And so when we help families understand the illness better in an accurate way, then they can team up with the person who has psychosis more effectively. And then there's a skill building component. So every family needs to be able to communicate with each other, solve problems together, manage stressors from daily life together. But sometimes families lack those skills. And so we're looking at this as an opportunity to build and develop those skills in families. So I'm going to give you a little teaser of something that might be part of our training track. And I want you to think about family systems, right? So I kind of categorize techniques in two compartments, right? There's what happens between people within families, and there's what happens within each individual person. I'm going to talk a little bit about what happens within people when they're interacting with their family members or the cognitive processes that occur. And the thing to know here is that we talk a lot in CBTp about thoughts, right? And how thoughts and beliefs shape our behavior. Well, the same things apply within families, right? When you're interacting with a family member, you have a perception about what that person is doing and why they're doing it. And they also have a perception about why you're doing or engaging in a behavior, right? And so there's mutual influence, like Danelle said in the beginning. And a lot of times when families are in conflict, they blame each other or they fight about, different perceptions about certain events. And there's this bidirectional influence, like we talked about. Cognitive processes include attributions, expectations, and assumptions. These are the particular kinds of thoughts that emerge when people are in conflict and are having trouble in their relationships. So, attributions are just our explanations for why other people do what they do. Expectations have more of a component of looking into the future. There are predictions about what our family members will do next. Both of those things impact how we relate to people. And then our assumptions, we talk a lot in CBT about assumptions. When people have assumptions about how families are supposed to function, expectations or beliefs about relationships, what it means to have a healthy family, what it means to have an unhealthy family, those also kind of function or operate in the background. So I'll give you a small example from my life. So yesterday evening, my significant other's son, who's 4 years old, had a toy taken away from him by his older sister. And his response to that was very, very negative. He took that toy back and he kind of angrily held it up in the air. And it looked to me like he was about to hit his sister. And so I turned to him and in a stern voice, I said, "No, put that down." And then he started to cry. So, what are some of the attributions that I made about him? Well, I thought he was going to hurt his sister, so I had to jump in, right? He also made some attributions about why I was behaving the way I was behaving. He thought I was being mean to him, and so he started crying and he ran to his mom, right? Simple example, but this is how conflict starts sometimes in families, right? People have different perceptions. And so that's kind of what we're talking about here is working with that and helping people process and work through that. And so one technique is we talk a lot in our general training about just asking curious questions. Now, when we talk about it in individuals, we're talking about getting to know their experiences of psychosis. But you can take the same curious questions and just apply that curiosity to family systems. So who's in the family system? Again, families are not necessarily just biological relatives, they might be others, that are important. So it's good to know who that is. What's everybody's perspective on the problem, right? What was my perspective? What was the little boy's perspective, right? Our perspectives were different. It's important to attend to everybody's perspective and not leave anybody out so that nobody's perspective gets sidelined. How's the problem impacted people? Have there been any changes? I mean, you can look at these questions, but these questions really just form the basis of curiosity. Apply that to families. And so, Danelle will close up and tell you about our next steps.
Yeah, thanks, Brian. That was great. All right. So overall, takeaways, our family systems work is really critical, even with individual work that you are doing. And it really doesn't need to be as scary or intimidating as it probably feels. I think some people think it feels like group work on emotional steroids. But if you are given some of that guidance, some of that structure and how to approach these conversations with individuals, how to approach family systems, you can feel a lot more confident and competent in this area if this wasn't part of your training. So, we're hoping to provide a structured approach to this family systems work. And really, as Brian said, building on skills that you already have, just making them more translating those skills or generalizing those skills. So next steps, we're hoping you all will join us in thinking about this training track and then hopefully at some point join us on the training track. And so, today we wanted to take the opportunity just to get some feedback and level of interest. And if this is something that you feel would be helpful to you all as CBTP trained folks. And then after, shortly, in the next couple months, really thinking about identifying a working group to identify, what are those topics that are really important to a CBTP clinician who does this work with individuals every day. And so to make sure that, we're including the most critical information without something feeling overwhelming. So, we're going to hear from the centers team in a couple of minutes, and they're going to provide us with a really nice case that has some family involvement so we can see where there might be some synergy and where the potential training opportunities would assist with this case. But before we move into that, I wanted to see if there were some initial questions that you all have or thoughts about what this might look like, or if you want to share if this is something that you feel would be helpful and that you would be interested in participating. So just any kind of generalized feedback.